When I was first diagnosed with the word cancer, as you might expect, it sends an uncomfortable feeling.
It was sad. I was sad. I was scared.
I first kind of realized that I might have some kind of issues with my prostate. I was finding a sense of urgency in terms of urination and frequency to go to the bathroom. We went in and did a biopsy, and the biopsy was inconclusive. We went back a second time several weeks later and did find some cancer inside of my prostate.
Prostate cancer usually affects men 60 and older. It can happen in younger age, and we have seen a lot of prostate cancer in men younger than age 50 actually. And unfortunately, the younger the age at the time of diagnosis, the worse the outcome.
Fear was the first thing that crossed my mind.
And I couldn't change it. So it was a helpless feeling in a way.
The good news in prostate cancer is most of the time, especially if it's caught early, there are so many excellent options that can cure the patient and maintain excellent quality of life as well.
And so there's everything from radiation to seed implants to a radical prostatectomy to Da Vinci robot, which goes in and actually removes the prostate.
The news could be devastating for patients and their family, but when they gather information, most of the time when they meet the experts and discuss the options, they breathe easier.
The route that I chose was to go with the Da Vinci robot, which was a form of a radical prostatectomy, but tends to be more nerve sparing and a little less invasive. The procedure was done very effectively. In fact, I just spent one night in the hospital, and about a year and a half post-procedure, we noticed that I had a spike in my PSA. Basically, that was an indication to Dr. Schultz that I had a reoccurring cancer that was outside of the prostate.
The cure rate is 90%, so 1 out of 10 the cancer will come back. And unfortunately, in Tom's situation, that was the case.
So at that point in time, we consulted with Dr. Abe Abdallah over at Radiation Oncology at the Holston Cancer Center, and the decision was made to go through a 42-day radiation treatment to basically eradicate anything that was in my lymph node system.
You know, I knew that I needed to be a support person for him and lift him up on the days he wasn't lifted. Although, you know, Tom is a very uplifted person most of the time. So I have to say my job was pretty easy.
When we discuss the options of each patient, whether it's myself or other physician, urologist or a radiation oncologist, all the side effects need to be discussed frankly, and we discuss that with patients.
One, I wanted to make sure that I was cancer-free. And secondly, obviously, I would like to be continent. And then last, you know, I'm a young man that still has sexual desires and would like to be sexually active. So I would say that those all three were addressed very aggressively in the front end.
Oh my gosh, with 4 grandchildren in our life, I can't imagine not having Tom there. So I'm just so thankful that he got checked.
If you really want to be a man, don't be embarrassed to check your health with your go in for regular checkups. See your internal medicine, your family practice doctor. Get a PSA. Get an rectal exam to make sure that your prostate is working properly. Go to all efforts to try to make sure that you're healthy. I think you owe it to your family and you owe it to yourself. And I think that that's a critical component in terms of just manning up and doing the right thing.